Okay, well, there's been a big rise in younger patients having major joint replacement surgeries. So joining us right now is Dr. A. Sorry, I didn't go with the name.
Saying your name, Ahluwalia.
So we just-
But you know
She
what?
loves it.
He's the new kid. Have you two not met?
No, first time. Here we go.
Absolutely.
So you were talking about this last week a little bit
Yes,
briefly.
yes.
Tell us more.
So, we know that joint replacements in general are going up, but
You don't know why?
Well, we know, but what's surprising is that the younger patients are getting many more. So we have patients who are between 45 and 64. We consider them young.
So baby
right?
boomer-ish.
Yes, baby boomerish. And what we found when we studied them was that the percentage of joint replacements in younger patients have gone up threefold in the last decade.
Is it because they want to be more active, or are they doing crazier things to mess up their joints?
I think it's many things. So I think obesity is number one, right? So 1 pound on your body is like 4 pounds on your knees. We talked about that before. But more than that is working out. We're going crazy. We eat more and we work out more.
So do you try to get people to lose weight first before going to the joint replacement surgery, or has the damage already been done?
It's catch-22, right? They're already hurting their knees, or the knees already hurt, and we want them to lose weight. It's hard for them to do that.
So what kind of workout can you do that doesn't hurt your knees? Because I'm probably one of these crazy people that'll have to have this done. I just started playing beach volleyball, and maybe I shouldn't have started that because I've already done something to my knee.
You know what? On the beach, it's not a bad idea.
Okay.
What we don't like is people pounding on concrete, right? So running is not
Basketball.
such a
What about swimming? That's got to be a great.
Swimming is great. Swimming is great. But do like a recumbent bike with less resistance. You're still getting your cardio, but you're not pounding on your knees, right? So that's a good idea. Cross training. Change your exercise around. Don't keep doing the same thing over and over again, right?
So is this advice for young people as they
hit 45, like for 30s on them?
Everybody, right?
Everybody.
But
That's all I do is run.
Right. But the main thing now is that the joint replacements are better, right? We have better techniques to do them, and most importantly, younger patients aren't willing to accept using a cane or hobbling around, right? We're more about our lifestyle. So
but we should be more resilient, I would think.
Yes, but the thing is, if I told you, you know what, your knees hurt, just, don't worry about it. Take an Advil and just, limp around.
Right.
That's not good enough. It used to be good enough 20 years ago. It's not good enough anymore.
No.
So we have patients who come in whose knees hurt. Maybe they're not ready for surgery yet, but they want it. They want to get back to their lifestyle. They want to play. They want to do things. So
Excuse me, Bobby's getting a call.
Bobby's getting his knee replacement. Yes, they have the kneecaps in it or in. You are.
So are the joint replacements at that young of an age?
Yes.
I mean, are they effective, or what happens
Absolutely.
after that?
So joint replacement surgeries, hips and knees, are some of the most effective surgeries that we have, right? But they have a finite life. So it used to be 15 to 20 years, maybe a little bit more now since we have better implants.
So you might have to do it twice?
So the younger you are, the more likely it is that you'd need
just
more.
avoid all this altogether.
Right, but the thing is, if you already have arthritis and you're 50 years old, would you rather be in pain for 10 years, or would you rather get this done and deal with it when you're 70?
Get it
right?
done and deal with it
Exactly.
later.
So
Yeah.
that's what we're telling people, is that if your knees really hurt, we have things to help you.
Thank you, Dr. Ahluwalia.
Absolutely.
Thank you, Dr. Ahluwalia.
Oh, very nice. See how this works?
Ahluwalia, got it.
All right, next, how to make sure your Memorial Day barbecue is a safe one. Don't go to Bob's. That's number one.
Definitely.
I think you are doing the segment.
Ooh,
So you will be grilling for the second
and then
time.
we'll be talking.